Taking care of our body should apply to every tiny part, including our hair and nails. What can Filipinos do to keep their crowning glory strong and healthy? We talk about hair and nail care with dermatologist Mae Ramirez Quizon. Doc, thank you so much for joining us. So what is this idea between how our hair is our crowning glory?
So you hear a lot of sayings about nails, and I think even Coco Chanel had this saying where she said, a woman who cuts her hair is about to change her life. So that really gives you an idea like how hair impacts the way we perceive ourselves, the way we feel that people perceive us. So I think it has a lot to do with our confidence, like our personality, our personal style, etc. So taking care of our hair is really important.
Really, really important indeed, because everyone fears losing their hair. Doc, what are the possible causes of hair loss?
Well, I think first of all, we should define what hair loss is. So hair loss could be many things. So for some people, it's a gradual loss of hair. Some it's sudden. For some, it's just a patchy loss of hair on some parts of the scalp. But for some, it's like a whole body hair loss. So things like that. And the causes of which are different. So for each type of hair loss, the causes would be different. But I think the most common would be the hereditary form of hair loss, where we see like a gradual thinning of hair. So for males and females, we call that pattern hair loss. It's a little different for males. For males, we see them losing hair on the front, on the side, and probably on this part of the scalp.
Yeah.
But for women, we mostly see it as like a broadening of the area where you part your hair. So if you always part your hair, this part, you see that it's broadening, kind of broadening, or like when the hair is wet, you feel that kitang-kita na yung anit mo. You see
Yes.
the scalp, the vertex part, the top part of your head. So aside from hereditary, hair loss can be caused by immune processes, so immune mediated processes.
Oo.
So like poknat or alopecia areata, that's an immune mediated hair loss disorder. Other hair loss disorders can be caused by medications, like for chemotherapy, for arthritis, for hypertension. And still other types of hair loss can be caused by some people knowingly or unknowingly tugging on their hair or pulling their hair.
All right.
So things like that.
Doc, look at my scalp. It's already thinning out. Oh. I might have to see you.
Yeah, they say that men have probably 5 to 6 times more risk of having male pattern hair loss or baldness when your father has baldness. So take a look at your relatives if they're thinning.
Well, my dad is 95 years old and he still has a lot of hair. So hopefully it is hereditary. Keeping my fingers crossed. From hair loss now, Doc, let's now focus on our nails. Can it indicate the state of one's health?
Oh, definitely. So your nails are like a window to your health. So the timing even of nail disorders can tell you can predict it. So dermatologists can predict, like if you say have COVID and somehow in certain diseases like COVID or hand, foot, mouth disease, your body starts to divert its energy towards fighting that infection, and somehow nail growth stops because your body is trying to prioritize. And you see 2 months after the infection, you see like a break in your nail. It looks like it has stopped working. It doesn't happen for everyone, but just to tell you that the timing of the diseases can manifest itself in your nails.
So
and
Doc,
still other.
So Doc, how should we be taking care of our nails?
First, you have to keep your nails free from dirt. You have to wash your hands regularly. But also the cutting of your nails and nail care is very important. So for example, most of people around the world, not just Filipinos, like to cut the side of the nails. So that's actually not
advisable.
Not how we want you to cut your nails. So the ideal way of cutting your nails is cut it square or straight across and just file gently around the edges. That's to prevent it, especially your toenails, from growing into the side of the skin. So that fold around your nail, so it's called the nail folds, because that can cause ingrown toenails. Of course, We also ask patients not to cut the cuticle or push the cuticle because that serves like as a barrier for infection, like bacteria, viruses, and fungi from coming into your skin, and also to cut them regularly.
Right.
Try to avoid too much nail polish or artificial nails. Have a good break, a holiday between nail polish, probably about 2 weeks, and don't let it stay on your nails for too long.
All right. Thank you so
Yeah,
much
and
for this
also
very
put nail
important
care.
advice. Thank you so much for this very important advice on how to take care of our hair and our nails. Dermatologist
You're
Dr. Mae Ramirez Quizon.